So I would say where the mental health system has not been helpful for me was when I was first really sick, and I had gone down to Emerge actually by myself and was put in a room with a box of Kleenex for 5 hours alone. And finally a doctor did come in and told me that they would try and find a psychiatrist that they could book me an appointment with in a few more weeks. At that time, I was having suicidal thoughts. It was taking everything in me to even stay alive, to sleep at night, to think straight. So to be sent home in that condition was not helpful whatsoever.
The ways that didn't really help me, I found, was that when I came out of the hospital, I found that they more or less dropped me off in a shelter in a very bad environment that I noticed, that I realized that I had to improve that environment in myself, like finding my own place to live. There wasn't many supports for that, I found.
There have been issues with certain agencies that I've used. One thing that I found is that mental health services still tend to be a bit siloed, so the right hand doesn't know what the left hand is doing. Staff, even within the same agency, do not speak to one another. So you end up having to tell your story and give everyone updates like 10 different times to each different professional that you see. So I wish it was a bit more unified.
Well, I don't think you have enough contact with professional people in general if you have a mental illness. You're sort of treated like a number sometimes. There isn't enough communication going on between me and the healthcare providers. I think that could be better, that's all. Some kind of clinic or something, I don't know.
I've tried to see a psychiatrist a few times, no luck at a hospital. I seen a psychiatrist back in 2003 because I attempted suicide by pills at that time. Was in the hospital for 3 weeks. Wasn't given any diagnosis, but was put on Seroquel to help me sleep at night because I wasn't sleeping. And then also Zoloft. Was told if I needed to see a psychiatrist, I would need to ask my family doctor, which I did at the time, with no luck. I've asked my new doctor, I want to see a psychiatrist. I still, a year and a half, 2 years later now, have not been able to see one out of hospital.
The drawback on it is that they don't do follow-up either with the social worker or anything like that, but a phone call doesn't cut it. That's the tough part, doing follow-ups, because sometimes if they don't do follow-up and use a social worker or something like that, pay a home visit, even though they're not in a deep crisis or anything, like extreme crisis or anything, but just a follow-up and a home visit at least another 3 months, at least once a week, just to see how the person's doing and how they're coping, and that type of thing. It doesn't happen when those are not in extreme crisis, but just with that follow-up, that would make a big deal.
So when I was hospitalized, I did get the proper care eventually, as in the proper medications and things like that. I was released after about 3 months, though, with absolutely no supports, none. I was told I was on a priority list for a psychologist, but it would take up to a year to have one. And so we were forced to kind of look around for a counselor on our own, which took months and pay out of pocket. And I'm trying to also be a mother to my 2 kids and a wife to my husband. And that was extremely difficult to try and recover with absolutely no supports in the mental health field.
It leaves me feeling that I'm on my own, and it's up to me to look after myself. Because they put you on a medication, they think you're going to be all right unless something happens. So you're not getting enough help.
I think COVID was especially difficult. Normally I socially isolate myself anyhow, but having that kind of enforced upon us, it didn't help. And some agencies had policies where their staff were not allowed to use virtual software and meet via Teams or Zoom or whatever it was. So I literally couldn't see the people that I was used to seeing, and I do not like using the phone. So that was a real setback for me.
I was feeling suicidal back June of 2022. Made an appointment with my family doctor. He advised me, he phoned the hospital, advised me go to the hospital. While I was at the hospital, I told them I was suicidal. I didn't want to go back home because if I did, I would take the medication that I had been keeping. And they kept, insisting, we'll get you help, release me. And I specifically said to the doctor many times, if you let me go home, I will not be here tomorrow. A mental health system, to me, has not worked, has let me down.
I would say the mental health system has helped me by offering good resources. When I was hospitalized a number of years ago, they did have good information there that I could read through to understand more about my depression and anxiety disorder that I had at the time. I was also fortunate to have good doctors that got me on proper medication, even though it took a few months, and I was able to get my life back, which was great.
How the mental health system has helped me. Let's see, I called the police. There were some issues I was going through, and they thought that I always thought somebody was doing something or something like that against me, and the police, they suggested that they would call the Mental Health Association, so they did. They called the crisis line for me, and I was down there at least once a week, seeing a crisis team, someone from the crisis team. We had appointments. How they helped me is just personal issues that I'm going through, and just have somebody to talk to unload. And that was the thing I needed. I just needed to unload and talk about my personal issues, and just have somebody there just to talk to, and it helped me sort my head out, what I need to do, what I don't need to do, and also to cope.
I feel I've gotten more help from coming to Peers and going to our place at the Alliance Church than I have throughout my whole life. Peers is peer support. They help people if they need help, or they'll put them in the right direction to get the help that they need. Many times I've came here, talked with other peers, talked with staff, and staff are very helpful. I feel I've gotten really good help both from Peers and our place.
It has helped me cope with just living my life, like being able to stay out of hospital. If I wasn't on medication and I didn't have some kind of intervention, I think I wouldn't be doing as well. So it's helped me cope with whatever is going on with me. Like I have mania, and the mental health system through the intervention has helped me control that, because that's my essential problem is if I don't take any medication, I sort of go off the deep end. So it's helped me in general with that. Being able to talk to people in the mental health system and the medication, both those things have helped. And also having a family doctor for 20 years, and she's helped me. So I think by having contact with a doctor or the system, it's helped me, maintain my well-being and stay at hospital.
I've been accessing a bunch of different mental health services since I moved to Kingston in 2005. Most of them I would say have been extremely helpful. I would never in a million years be on camera if it hadn't been for the services that I'd received from certain agencies. I wouldn't be working if I hadn't received the help that I have. I've been privileged to be able to access a number of different types of services. So not just your traditional, psychotherapy or whatnot, but some agencies have been creative and thought outside of the box. So they would do like, group walks at Lemoyne Point. There's been like animal therapy. There's been art therapy that I've been able to do, musical therapy. So I think that that's been really beneficial to me, just allowing me to explore my creative side and get help that way.
The mental health system has helped me to recognize that I suffered with drug addiction and to get sober throughout my own life and change my diet, because I found my mental health really was affected by my diet and struggling with drug addiction throughout the course of my life. I think somebody in my life personally recognized that I was struggling throughout problems in my life in my late 20s and helped me get sober and helped me go through the mental programs that I went through to really notice what was wrong with me within myself.
I think the mental health system could improve with support systems being in place. I know there are some for people that are released from the hospital, but I know a lot of people do fall through the cracks. So it's either we have to get a lot more mental health professionals because there's not enough to meet the needs of the amount of people that are struggling mentally, or maybe there could be some kind of system where even volunteers check in with people once they've left the hospital, maybe once a week to see how they're doing while they're waiting for their other appointments. That is one thought that I kind of have, and I think it would have been helpful for me, somebody checking in who either had experience and was recovered, if possible, because talking to friends and family are not the same. There's something about, just really understanding what it's like to go through a mental health crisis.
The areas they can improve in is follow-up. Those who come through there or the crisis team, maybe they pay a home visit. Sometimes they do that. It's follow-up. Have social community social worker that's just specifically trained for that type of thing for those who are not extreme cases or anything like that, but have a specific community social worker just to do follow-up with the certain people, even though the file is closed. But I don't think they should close the file right away. They should have I think they're improved in the area, but pending, and then have a community social worker check up on the person maybe once a week or maybe after 3 months, do a follow-up, and with the person, see how they're coping.
People that have been through similar situations as me, that are psychiatrists or mental health workers, to me, do a better job than people who haven't. I would like to see more mental health workers listen to people better and help more.
Proper housing, I think would be the best bet. More communication with more people who'd be willing to help people find the better resources to help them as well. So that'd definitely be a way to do it.
Everyone immediately goes to, we need more money, we need more funding for this and this and this. And that's definitely true. Money definitely helps to fund more positions in mental health. But I think that there is things that can be improved upon without spending a ton of money. I think communication needs to be improved. When I myself have probably close to 16 different specialists that I see for various problems, and with mental health being among them, that kind of impacts all of the other specialists that I see because of physical conditions, say. But because none of them talk to one another, I'm left again telling my story over and over and over again. I know it would be impossible to get them all in one room at the same time to say, okay, let's talk about Sarah. But I definitely think this day and age there should be a digital platform where everyone can access the same kind of information about me, so everyone's up to date and knows what's going on.
People that have addictions and alcohol problems have groups they go to every day sometimes. Whereas if you have a mental illness, apart from senior doctor, there's not much else going on. So there isn't enough contact with the system. That's been my problem, I think, over the years. You shouldn't have to wait till something gets bad before you get it looked at.